John Barilaro, there were just 4 cases recorded in the state yesterday. Can you give us an indication of today's figures?
Yes, good morning, Danica. And look, what I am pleased about is testing numbers are up. We will be in single digits again today, and the official numbers will be announced at 11 o'clock. And it still gives me confidence that our health officials and our staff on the ground are doing all the work necessary as a government so that we can be confident in some of the decision making going forward. But I'm very confident that we're completely in control. But as always wanting people to be aware, and we still need more people to be tested.
Absolutely. Now, we heard yesterday of an infected teenager's 900-kilometre road trip. It's now impacting Orange, Nyngan and Broken Hill. How concerned are you for regional New South Wales?
Yeah, look, it shows how volatile it can be. And this young man, 18-year-old man, responded to a text message from health, got tested. He woke up with the sniffles, thought maybe I should get tested, got tested and was positive. He's been able to give us his itinerary. We know exactly the locations that he travelled. It was a camping trip. We've been testing his mates. Everything he's done is perfect to the book in relation to how to respond to those communities of Orange, Nyngan and Broken Hill. No need to be alarmed, but be aware. The key to success will be, again, coming out and testing. And we've got those pop-up clinics, those drive-through clinics already in place in those communities. And I encourage everyone in regional rural New South Wales connected to those communities to jump on the New South Wales Health website, find out where the testing clinics are. More importantly, the venues that this young man had attended, and get tested if you have any symptom at all.
And what is the testing situation in the bush? Are they equipped? Do they have the infrastructure in place for an increase of tests?
Absolutely. Within hours yesterday, we were able to have clinics put up in place. In Broken Hill, it's at the community centre. That's one of the testing sites. That's the drive-through site. But there are other areas in Broken Hill. In Nyngan, it's at the drive-through sites at the statue of the Big Bogan, and then again, other health services are testing. And the same in Orange, where at the showground we have the drive-through at the showground, but again, other agencies within Orange are testing. So we've got the infrastructure in place, backed by, of course, the whole of the New South Wales Health Agency, and that's why I'm confident that we've got everything in place to get a true read of what's happening in regional and rural New South Wales.
There's a planned return to the office next week for workers in Sydney's CBD. Has the state government policy on this changed due to the outbreaks, or is the plan that people can still go back to work on Monday?
Well, at this stage, on the advice from health, again, it is business as usual. So this morning we do have our emergency committee meeting that we meet once a week in relation to dealing with what's ahead of us. I'll be chairing that with the absence of the Premier. And we'll be discussing all of this, plus other issues that arise each week. And as I've said, the same for the cricket test. We'll always prepare to be flexible on the advice from health to make changes. But at this stage, everything is as we've previously announced.
Speaking of the cricket test, it's tomorrow. Are you nervous?
I think I'm nervous about the result for Australia more so than what's occurring at the stadium. Look, I snuck out there yesterday, had an opportunity to walk the SCG with the management and go through their protocols, and I'm confident that everything's in place to make it as risk-free as possible, but there's always risk.
There are calls for all states and territories to test flight crews to help bolster our hotel quarantine systems. Will it be made mandatory, do you think?
Well, that's a good question. A lot of airlines do a lot of that themselves. Sorry, I've just said
no, that's all right. As long as you're okay, Minister. I mean, for it to be made mandatory, you're most welcome to take some water while we discuss it. Obviously, particularly in regards to that UK strain that has popped up in a number of hotel quarantine around the country, that's obviously cause for concern. But flight crews are an issue. Should they be tested upon arrival?
Well, again, we've got protocols and measures in place. And how we actually manage that, what we do is work with the airlines. They've got their COVID safe plan. And then we as a government and our agency, our health experts, we work through all of that, and we're confident in what has been in place to this point. But the reality here is that things change on a daily basis. And as I said earlier, we do have our committee meeting shortly, and we're able to discuss a number of other arrangements.
All right, and just finally, now you've called for international arrivals to be put on a domestic flight to get to their home states. The WA Premier has labelled your comments as selfish. What's your response to this?
Well, my comment was all about actually each state doing more of the heavy lifting. New South Wales, at 120,000 international passengers, have done the heavy lifting when 50% of those passengers end up in another state. And these premiers and other states are quick to lecture New South Wales about improving our system. So my comment was off the back of, hang on, if you're going to lecture us, why don't you do more of the heavy lifting? Because at the moment we're carrying the burden and the risk, and we're actually being able to do that on behalf of Australia. We are all Australians. We are all in this together. But at the same time, other states need to do more. All
right, John Barilaro, I'll let you go to have a glass of water, and I certainly hope you're okay.
I am. Thank you very much. Talk soon.
Thank you.